Hey everyone, Amy Wood, joined by Dr. Cedrek McFadden, our 7 News medical expert. This month, I don't know if you're aware, is Ovarian Cancer Awareness Month, which is a really important time to raise awareness because this is one of those cancers, Dr. C, that if it's not caught early, can really be so tough to win with. And ovarian cancer, how common is it? I mean, how many women are being impacted by this potentially deadly illness?
So while it's the 11th most common cancer in women in the United States, it's the fifth leading cause of cancer deaths. It's one of the more deadly gynecological cancers. It's more common in women in their 50s and 60s. Unlike colon cancer, we've seen it increase in younger patients. We're not seeing the exact same thing as frequently in women. But here's the key. With ovarian cancer, it's often characterized as being a sort of silent killer because of the symptoms. And so in this particular cancer, like several others, symptoms really dictate earlier treatment.
And when it comes to detecting it earlier, I mean, how tough is it and what do women need to be paying attention to or looking out for so that they do catch it?
So there are some signs, and if you go back in history, many women who had ovarian cancer may have been disregarded. They may have been thought to just have IBS or irritable bowel syndrome, when in fact they were having signs and symptoms from ovarian cancer. These are very common symptoms for other problems. So we're talking about abdominal bloating or pain, pelvic pain, abdominal fullness, perhaps eating and feeling very full shortly after eating. You may even have some urinary incontinence symptoms that are present. But again, these are very common symptoms that just, don't ring out ovarian cancer. So we always have to have a high index of suspicion and pay attention to the clinical picture when you're talking to the doctor.
When it comes to detecting it, right? What is the testing that's involved? I mean, a lot of women go and get their annual pap smear. Is that a test that will somehow open the window to detecting this potential silent killer?
One of the biggest myths about ovarian cancer is that a pap smear will be used as a screening test or detection for ovarian cancer, when in reality, a pap smear is checking for cervical cancer and it will do nothing to detect ovarian cancer. But a pelvic exam may raise the red flag, but unfortunately, sometimes there are no real findings on physical exam. But physical exam, along with a couple of other tests, may give some indication, whether it be an ultrasound or a simple blood test called a CA-125. I'll give you a brief explanation. The CA-125 is not, a great screening test. In fact, there is no definite, we have the mammogram for breast cancer, colonoscopy for colon cancer. We don't have a great screening test for ovarian cancer, but screening tests are being researched and a lot of energy has been put into finding one that can be useful for ovarian cancer.
Talk a little bit, Dr. C, about the symptoms that women need to truly tap into, pay attention to, that they might be missing this.
Well, it comes down to knowing your body and knowing when something isn't right. And unfortunately, early disease may not have any symptoms at all. You may only find it just through an exam, or perhaps it's diagnosed much later. In fact, when we see these patients come in, they may be complaining of, abdominal fullness. They may be complaining of, in later stage, more GI symptoms such as nausea or even vomiting, especially if it's more obstructing symptoms where there's a blockage because of the tumor that's surrounding the intestine. So the symptoms have to be caught early and they have to be brought to the attention. And when you bring them to your doctor's attention, they have to listen. And you have to be very persistent sometimes to ensure that you're being heard.
What about diagnosing it? How is the diagnosis made if there really aren't any screening tests?
One of the toughest problems with ovarian cancer. There are several things we've talked about, such as the pelvic exam that may give some indications or symptoms that come to cause you to have some more detailed testing. But commonly we'll see an ultrasound being performed or even a CAT scan or a CT scan. That ultrasound may show that there's fluid within the abdominal cavity that may need to be sampled and taken to the lab to look to see if there are any cancer cells present. A CT or a CAT scan may also be useful, as well as an X-ray to see if there's any disease that's present in the chest. But again, there's no real clear test that's above all the others. It's a constellation of symptoms. And one other one that surgeons often will come to, which you'll see a gynecological oncologist, someone who does this type of treatment. They may do what we call a diagnostic laparoscopy, where a camera is placed into the abdominal cavity to see if there's any abnormalities, if there's cancer present. It may help determine the stage of that disease. And finally, it bears repeating the importance of genetics. Genetics may come in a role, especially if they're, we've talked about the BRCA1 and BRCA2 genes. That may come into play in helping to diagnose ovarian cancer. But the key here, paying attention to symptoms, talking with your doctor sooner than later.
We appreciate you raising the awareness. Thanks, Dr. C.
Thank you.